For many Americans, their healthcare solution in retirement is going to come from Medicare. But understanding what Medicare is, what it covers, what it doesn't cover, and how much it could potentially cost you each month for your coverage is the purpose of this video. Stay tuned. Welcome back to Financial Wellness Planning. My name is Derek Coffey, and I'm the founder of FWP. And one of the greatest expenses that a retiree is going to have to face in retirement is their healthcare costs. Fortunately for them, there's Medicare. Medicare is a federally run insurance program for those that are over the age of 65, those that are younger than 65 and on disability, and those that have end-stage renal disease. Medicare is broken down into 4 distinct parts: Parts A, B, C, and D. Part A is what's known as your hospital insurance, and the purpose of Medicare Part A is to cover the costs associated with using a medical facility. And these costs could come from being admitted to the hospital for an extended period of time, having to spend time at a skilled nursing facility, and even for home health services. For the majority of people, Medicare Part A is free. If you have worked for 10 years and you've actively contributed to Social Security and Medicare, then Part A is available to you for free. If you're receiving your Social Security benefit 4 months prior to you turning 65, then you're going to automatically be enrolled in Medicare Part A. If you are not yet receiving your Social Security benefits and you do turn 65, then you're going to have to apply for your Medicare coverage directly with Social Security. When it comes to Medicare Part A, there are deductibles that you need to be aware of. The first of which is if you get admitted to the hospital. If you get admitted to the hospital, you're going to owe $1,632 as a deductible, and this is only meant to cover the first 60 days. If you need to stay there longer than 60 days, then from day 61 to day 90, it's going to cost you $408 per day. If you need to stay there longer than 90 days, anything after day 90 is going to cost you $816 per day. If you're admitted to a skilled nursing facility, those numbers come down slightly. For the first 20 days in a skilled nursing facility, it costs you nothing. But if you need to be there beyond day 20, it's going to cost you $204 per day. The one thing I want you to keep in mind is that these deductibles are what you're going to owe per benefit period. Per Medicare, a benefit period is 60 days. So if you go to the hospital for 60 days, you're going to owe the $1,632. If you go home for a month and then have to go back to the hospital, you're going to owe that $1,632 again. And it's the same thing for the skilled nursing facilities. But some of those costs can be alleviated with a Medicare Advantage or a Medicare Supplement plan, and we're going to get into those later in this video. One thing that I do want you to understand about Medicare Part A is that it should not be confused with long-term care insurance. Now, if you're in a long-term care facility for rehabilitative purposes, Medicare Part A will cover the costs. But if you are in a facility for long-term care related reasons, then Medicare Part A is not going to cover the costs of you being there. The second part of your Medicare coverage is Medicare Part B. And the purpose of Medicare Part B is to act as your medical insurance, and it's there to help cover the costs associated with the medical care that you receive. With Medicare Part B, there is a monthly cost for this coverage. The monthly premium for Medicare Part B is $174.40. If you're receiving Social Security before you get on Medicare Part B, then your Social Security benefit is going to be reduced by that monthly premium. If you're not yet receiving your Social Security benefit, then you're going to have to pay that monthly premium directly to Medicare. There's also an annual deductible that's associated with Medicare Part B, and as of 2024, that was $240. So for the first $240 of medical care that you receive, you're going to pay that all out of pocket. And then once you have hit that $240 deductible, you're then on the hook for 20% of any additional medical care that you require. Just like Medicare Part A, there is no annual out-of-pocket max with Medicare Part B. But again, we can still look to Medicare Advantage or Medicare Supplement plans to help alleviate some of those costs. One thing about Medicare Part B is that the coverage is voluntary. You can refuse to take it. But if you wait to get on Medicare Part B beyond your initial enrollment period, you're going to owe a late penalty. The initial enrollment period for Medicare Part B begins 3 months prior to the month that you turn 65. It lasts for 3 months after the month you turn 65. So as long as you get on Medicare Part B during this time frame, you are not in danger of any late enrollment penalties. Now, the late enrollment penalty is 10% for every 12 months you wait to get on Medicare Part B after you were eligible, and you pay this penalty for the rest of your life. So if you're not sure about what you should do about getting on Medicare Part B, then talk to someone and ensure that you don't miss this window if that's the only window available to you. Now, there are certain circumstances where you may be allowed to enroll during a special enrollment period, and this typically evolves around you working later than 65 and being on your own group plan at work. Or if you have a younger spouse who continues to work and they have at least 20 members on their group plan, then you can stay on that plan. But once those coverages end, regardless of where they come from, make sure you get on Medicare Part B as soon as you possibly can. In general, Medicare Parts A and B are meant to cover approximately 80% of your healthcare costs. The other 20% you're going to pay out of your own pocket. Parts A and B are what are considered traditional Medicare. They're offered directly from the federal government. You get your coverage through them, and they pay your medical bills for you. Parts C and D are not offered directly from the federal government. Parts C and D are offered directly from private insurance companies. Part C is what's typically referred to as Medicare Advantage. And Medicare Advantage plans are run by insurance companies, but they're overseen by Medicare. The way a Medicare Advantage plan works is that the insurance company offers to you your Part A, B, and in most cases Part D, or your prescription drug coverage, all in one policy. There are some plans that offer additional coverages like dental, hearing, and vision, all of the things that you're going to need as you get older. Typically, a Medicare Advantage plan is going to be cheaper than a Medicare supplement. The cost of a Medicare Advantage plan can be as little as $0 per month. And the reason this is because Medicare will pay the private insurance companies per person that they enroll in their Medicare Advantage plan. And this kind of acts as a reward to the insurance company for taking the stress of paying for your healthcare costs off of the federal government. The main reason that a Medicare Advantage plan is cheaper than a Medicare supplement is because you're limited to only the providers that are within the Medicare Advantage plan's network. And this is very similar to an HMO or a PPO. If you need to see a specialist for any reason, a Medicare Advantage plan is typically going to require you to have a referral to see that specialist. And in most cases, you're going to owe a copay when you make these visits. Depending on the plan that you're on, the maximum out-of-pocket for a Medicare Advantage plan is $8,850 as of 2024. Now, this out-of-pocket maximum could be less depending on what type of plan you are on, but as mandated by Medicare, the maximum out-of-pocket you're going to owe on a Medicare Advantage plan is $8,850. Medicare Advantage plans also change every year. The doctors that are in network one year may be out of network the next. So each year with your Medicare Advantage plan, you're going to need to sit down with a licensed professional and go over the options that are available to you. And this is to ensure that you have the coverage you need for the services that you need. If you decide that a Medicare Advantage plan is too restrictive or it doesn't give you the flexibility that you're looking for, then a Medicare supplement may be the right answer. Medicare supplements are just that. They are meant to supplement Medicare Parts A and B. So what happens is you keep your Part A and Part B coverages through Medicare and then go to an insurance company to purchase that supplemental policy. The purpose of these supplemental policies is to cover the coinsurance and deductibles that you would normally have to pay if you only had Medicare Parts A and B. The flexibility of a Medicare supplement plan comes from the fact that you can visit any provider that accepts Medicare, regardless of where you are within the United States. As long as you go to a provider that accepts Medicare, then the Medicare supplement is going to pay for your healthcare-related expenses. If you have an Advantage plan and you're out of network, then it may be difficult for you to get the care that you need. And this is due to the fact that if you're traveling, there's a high probability that the physician that you're going to see is out of network. One of the differences between the supplement and the Advantage plan is that there is no Part D coverage with a Medicare supplement. You're going to have to go to an insurance company to find that prescription drug coverage. The Advantage plan has it wrapped in. The supplement does not. With a Medicare supplement, you can enroll at any point after you turn 65 and you have Medicare Part B. If you enroll in your Medicare supplement within the initial enrollment period, you're not going to be subject to medical underwriting. During that initial enrollment period, the Medicare supplement will guarantee your coverage. If you wait beyond your initial enrollment period, you're going to be subject to that medical underwriting, which means you may not get covered. So even if you decide to purchase a Medicare Advantage plan and then switch to a Medicare supplement later on, then you're still going to have to go through that medical underwriting, which again means you may not be covered. There are many different Medicare supplement plans that are available. I want to highlight two specifically. Plan N and Plan G. Now understand, there are many more that are available to you, and you should investigate all of them to ensure that you're purchasing the right plan for your situation. But Plan N and Plan G typically lead to the most predictable cost of your healthcare needs. Plan N is going to be the less expensive option of the two. With Plan N, you're still on the hook for your copays and any excess physician charges, but all of the deductibles and coinsurances that you're going to experience being on Medicare Part A and B, Plan N is going to step in and cover those. So if you're an individual that doesn't go to the doctor very often or doesn't need to see a specialist for your healthcare needs, then Plan N may be the better option. And as of 2024, the monthly cost of Plan N is roughly $111 a month. The second option is Plan G. Plan G is going to be the more expensive option of the two, and it's more comprehensive in its coverages. There are no copays, there are no excess physician charges, and it still covers the deductibles and the coinsurances that are left over from Medicare Parts A and B. Plan G is going to be a good option for someone that needs to visit the doctor often or see a specialist for their conditions. I am a proponent of Plan G if it fits in your budget, and there are people that may want to argue that, and that's perfectly okay. But Plan G offers the most comprehensive coverage. You don't know what your healthcare needs are going to be from one year to the next, and this can be drastically different the older you get. So having Plan G, if it fits in your budget, is going to be a good idea, especially as you get older. As of 2024, the average cost of Plan G is approximately $148 a month. So it's almost $40 more than what Plan N is, but without the copays and without having to worry about the excess physician charges, it could be completely worth it. The final piece to your retirement health insurance plan is Medicare Part D. Now, if you're on a Medicare Advantage plan, Medicare Part D is most likely included in that policy. But if you decide to go the route of having a Medicare supplement, then you're going to need to purchase your prescription drug coverage elsewhere. I'm not going to get too far into Medicare Part D. And the reason that is because from company to company, the plans are different. The drugs that are covered from company to company are also different. So you need to find that licensed person to walk you through the plans that are available to you and explain to you which ones cover the drugs that you take. Also, with prescription drug plans, they're going to change each year. So every year, you're going to have to go back to that licensed individual to ensure that the plan that you have still covers the drugs that you need to take. Depending on the company that you work with, your prescription drug coverage could run approximately $50 a month. It could be lower, it could be higher. It just depends on the plan that you're on and the drugs that you take. As of 2024, your maximum out-of-pocket for your prescription drugs is going to land somewhere between $3,300 and $3,800 per year. This is all going to evolve around the drugs that you take and the plan that you're on. In 2025, thanks to the Inflation Reduction Act that was passed under the Biden administration, the maximum out-of-pocket for prescription drugs is going to decrease to $2,000. So this is going to alleviate a lot of financial stress for people that take those expensive prescription drugs. The final thing that I want to go over with you when it comes to Medicare is how much you should budget in retirement for your health insurance. If you decide to go the route of a Medicare Advantage plan, then Medicare Part A is free. You're still going to owe your Medicare monthly premium of $174.40. A Medicare Advantage plan, in some cases, could be free, but it may cost you upwards of $30. It all depends on the coverages that are included. You're not going to be eligible for a Medicare supplement if you're on a Medicare Advantage plan, so there's no cost associated to that. And with a Part D plan, you may have to pay out of pocket, but again, in most cases, it's going to be included in the Medicare Advantage plan. So the cheapest amount that you could budget if you're on Medicare Advantage is $174.40 per month, the amount that you pay for Medicare Part B. It could be upwards of $200 a month depending on if you need to pay anything for your Medicare Advantage plan. If you decide to go the route of the Medicare supplement, it's going to cost you a little bit more money. Medicare Part A is still going to be free. You're still going to owe the same $174.40 for your Medicare Part B. You're not going to owe anything for a Medicare Advantage plan because if you're on a Medicare supplement, you're not eligible for a Medicare Advantage plan. You're going to have to pay for that Medicare supplement each month, and that's going to run you roughly $148 a month if you decide to go with Plan G. And then you're also going to need to factor in your prescription drug coverage. So if we go with the rough average of 2024, you're going to need to add an additional $50 for that coverage. So in the worst case scenario, if you decide to go the route of the Medicare supplement, I would budget for $400 a month for your health insurance needs. Medicare is something that you should be putting quite a bit of thought into as you prepare for retirement. Not only should you be worrying about the cost and how that's going to fit into your budget, but you should also be worrying about what's actually going to be covered for when you need medical care. The easiest way to go about getting the coverage that you need is to find that licensed professional. Get them to walk you through all of the options that are available to you. They're going to get paid for selling you a policy, so make them work for that money. I want to thank you for tuning in. If this video or any of the other videos that I've put out has provided you some value, then hit that subscribe button. If you know someone that's creeping up on that Medicare age and they're not exactly sure what they should be doing, then send this video to them. Maybe it'll help them out. But I want to thank you again for tuning in. I'll talk to you soon.